morning, everybody. Thank you for having me. I'm Citsabehsan Devendran, or better known as Saab, because my name's a mouthful. I'm the head of sensor engineering at Proton Intelligence. We're a MedTech startup that's based here in Melbourne and around the world as well. We have a few other colleagues. My talk today is going to be slightly different from most of the other talks, where I'll be focusing more on our journey through the ANFF network rather than the technology itself. That being said, I'll give a little overview of the technology just to begin with. And to that end, I'll be talking about how ANFF has been an excellent enabling platform for us and for MedTech startups like us as well. So firstly is who are we? As mentioned, we're Proton Intelligence, and we're a medical technology startup here in Melbourne, doing all the R&D here. Just to give you a little overview of the challenges that we're trying to tackle today, the motivation and the vision. I've got a short 1-minute video that's narrated by our CEO. If y'all wouldn't mind, hope y'all enjoy it.
People with chronic kidney disease don't die of kidney failure, they die of heart attacks. Proton Intel's goal is to prevent that from happening by giving them visibility to the marker that causes that, which is potassium. Right now, doctors rely on a once-a-month lab test to make so many therapeutic decisions, whereas with real-time direct measurements of potassium through a tiny patch that we're developing, you can take preventative action. It's the hardest biomarker to monitor, and we figured it out. Clinicians can see the data, and they can make adjustments to medications that are life-saving for patients. Proton Intel has the only continuous potassium monitoring capability available that provides direct and real-time and accurate measurements. The core sensing technology is IP protected. We will make tremendous positive change. We're talking about disease populations that exceed 1 billion people, and all of them have major issues controlling their potassium levels. Without this data, both clinicians and patients are flying blind. What we're doing gives them confidence to keep patients on the right therapies with the right diet so that the patients can live a normal life while preserving their kidney functions for the future.
So now let's move on very briefly to what our technology is actually. As mentioned in the video earlier, we're developing the first ever continuous potassium sensor. Our sensor is going to have a very similar form factor to those of continuous glucose monitors or CGMs. For those who are aware, they're in the market already. The wearable itself will embed a lot of electronics required for the measurements and wireless data capture technologies that are required, as well as insert and deliver the sensor itself to the subcutaneous region of the user. Then this sensor will be able to directly and accurately, it's good. Oh, do I need to speak here? The sensor itself will be able to directly and accurately measure potassium levels in the interstitial fluid, directly relaying that information back to the users and the clinicians itself, giving them the power to act on it. And this can be done either via the use of adjusting their diets or the prescription of optimal kidney protective therapies itself. This data stream will then also not only reduce the short-term cost of managing hyperkalemia, but also in the long term will be able to ensure the preservation of kidney and cardiac health, therefore increasing the patient's quality of life, especially those that are at risk. The sensors itself are made on a rigid substrate within the clean rooms at the Melbourne Centre of Microfabrication in a scalable process using typical lithography and PVD techniques. These sensors are then released to realize their flexible nature and functionalize with our proprietary chemistry, enabling the sensitive measurements of potassium levels within a person or in vivo, essentially. This sensor is then incorporated within our in-house designed wearable towels and applicators and applied to the patients, as you can see in this video here by Barry, who's our design engineer, applying the wearable to himself. Now move on to at least the main part of what I would like to talk about is how ANFF has served as an enabling platform for us as a company, but also as other MedTech startups in the vicinity here. So firstly, ANFF has been extremely flexible with us. We started off with a single person working at the MCN, where we were afforded a little bit of lab bench space, a little office space, and some basic consumables, which meant that we could get the ball rolling on day one, developing the technology itself. And the flexibility was afforded to us where if we needed to grow, when we did grow, we were afforded more space and real estate as the demand required pretty easily. This meant that we could spend the money where it really mattered, which is in the development of the research and technology itself, as opposed to diverting resources to other aspects of the business, which you typically would have had to do. In addition to that, we were also afforded significant operational support, which meant we could focus on the development of the science rather than the development of the company on the early stages at least. And this meant that with the guidance of the ANFF, we were able to run our company in a OHS compliant manner, as well as the incorporation of lab management techniques, systems that help improve efficiencies like the Kanban system, 5S system, and so on and so forth. All this meant was that we could accelerate our growth really fast, not only in personnel numbers and footprint, but most importantly in the maturity of the technology, because all our resources could be diverted there as much as possible. And next, we also used the ANFF as a significant recruitment pipeline. And this isn't too surprising because the kind of talent and skill sets that we require is a place where the ANFF delivers readily. It's got the skill sets that are niche within the sector and really, really applicable to us. To give you an example, we currently have 11 people working here full-time in the R&D part of the company. Out of them, 3 of them have been directly hired through the ANFF network, and we have another couple that have joined our team indirectly, but also due to the ANFF itself. And finally, the ANFF is a significant collaborative environment for us. Similar to how the recruitment pipeline worked, it's a coming together of different knowledge sets and backgrounds that has a significant overlap in technique, which means there's a very easy organic sharing of knowledge and information, which has been very valuable for us as well throughout. Just a few acknowledgements of the platform. I'm getting a call. So we are primarily based at the Melbourne Centre of Nanofabrication, which is the Victorian node, not too far east from here. And if you hadn't noticed in the video that I showed you earlier, the entire video was filmed within the MCN itself, in different parts of the MCN, but entirely in the MCN with real people. We started off there very small. We started off with a single person in the wet lab, and as our company grew, we took up more space and more footprint in the wet lab, but once we outgrew that, we were afforded the privilege and opportunity to lease out the industry lab that's at the MCN, which is a private 30 square meter lab, and this further accelerated our sensor development and testing, which has been really, really significant as well to date. In addition to that, we extensively use the clean room facilities, both the class 10,000 and class 100 clean rooms at MCN, to process and fabricate all our wafers and sensors, and as well as the PC2 facility to do internal biocom cytotox studies as well. In addition to that, we also use the OptoFab facility over at Macquarie University to do a lot of the critical laser micromachining, and I work very closely with Alex and Benjamin. I think Alex is in the crowd. Yep, he is. And they've been significantly useful and helpful for us as well. And finally, bringing both of them together is the access to process engineers, which has been significant in getting to use the tools that are in play, as well as expert advice on how best to make use of these tools to benefit us as a company, and that's been immeasurably valuable. So we are still growing. We started off small. We started off with 1 employee, as I mentioned earlier. We currently have 11 employees full-time in Melbourne alone. This is void of everybody else around the world. And that's all thanks to the strong foundation that the ANFF has afforded us, where we could really, really divert all resources into developing our technology. And we would like to keep the momentum growing. We currently have an advanced prototype that we would like to clinically test very soon. And yeah, thank you. I'd like to thank mainly the MCN and OptoFab for a lot of their help throughout this journey, and we really appreciate it.
Thanks, Mark. We're a little bit ahead of time.
Yeah, all good.
Are there any questions on MedTech Startups and facilitation? Oh, 2 questions, I think.
I was just going to ask about lessons learnt in dealing with AMP. I mean, you presented a very sunny side up view there of the experience.
Yeah.
I'm sure there were some
So yes and no. So I mean, I worked with the MCN in different capacities over the past 12 years. So I've learned the little bits of politics and who to work with and how to work faster. So that's really aided a lot of the things. But there is obviously a structure of rigidity, at least to come with MCN, because it's a mix of industry partners as well as academic research. And what that means is that you don't really always have that access that industry really requires in terms of upscaling things a lot faster, usage times of instrumentation, downtimes that hopefully don't happen, and all these are very, very critical in an industry setting where we can't really have too much downtime. That being said, I think the MCN has been really, really good at dealing with those things, and they haven't really severely impacted us. But just in the mindset of how companies would like to go, I think somebody had a talk earlier that said that the industry always wants something yesterday. That kind of mindset needs to change a little bit, I think, in my opinion. And also having that connected network of how we can do testing of instrumentation as well as the technology due to standards, because we need to go through the regulatory pathway as well. Those are things that are a bit more difficult to navigate in Australia in general, but obviously also through the ANFF network itself.
So a bit more technical question.
Yep.
I think I've missed the kind of key moment there with the sensor. Does it use a micro needle or?
Yep. The sensors delivered very similar to that of CGMs that are in the market today. We use a microneedle, or as we like to term it in the industry, a lancet. Sounds nicer than a needle, but it's the same thing.